In this video, here's what we'll cover: how we read the week's research, the largest brain study of panic disorder, Medicare's new mental health check-in, why anxiety is polygenic, what this all means if you live with anxiety. Have you ever read a health headline that made your chest tighten? A new brain study, a scary-sounding word, a claim that something is wired into you for good when you already live with anxiety or panic. News like that can land heavily, so each week I sit down and read through the latest research with a careful, clinical eye. And I try to translate it into plain language. This week, the focus is anxiety and panic, and there is genuinely hopeful news to share. Before I get to the stories, a quick word on how I do this. I only draw from credible, primary sources, things like peer-reviewed journals, universities, and official health bodies, and I treat new findings as emerging, not settled. One study, however large, rarely changes clinical practice on its own. Science moves forward slowly, one careful step at a time, and that is exactly how it should be. So think of this as a tour of what is worth knowing, not a set of instructions. With that in mind, here are the 3 developments on my radar this week. The first is the largest brain study of panic disorder ever conducted. An international group called the Enigma Anxiety Working Group pulled brain scans from many countries to solve a long-standing problem. On their own, most brain imaging studies are simply too small to give reliable answers. By joining forces, the researchers brought together MRI data from nearly 5,000 people across 28 sites worldwide, comparing those with panic disorder to those without. A few findings stood out. The age when panic first began seemed to matter. People whose panic disorder started before the age of 21 later showed slightly larger fluid-filled spaces in the brain, with small to moderate effects. There were also subtle reductions in the thickness and surface area of some brain regions. Importantly, these patterns were not explained by medication, by other conditions, or by how severe the symptoms were. Here is how I read it. Carefully, this is a group-level pattern, averaged across thousands of people. It is not a scan you could use to diagnose panic in any one person. What it does offer is something many people in my practice find genuinely reassuring. Panic is a real condition with measurable biology. It is not a character flaw, and it is not all in your head. The second story is about access, and it is close to home here in Australia. The Medicare mental health check-in continues to roll out as part of this year's broader mental health reforms. It is free, it is open to anyone aged 16 and over, and it does not need a GP referral or a formal diagnosis. People start with a simple phone conversation, and may be offered a 6-week, low-intensity plan built around evidence-based techniques. Much of that is drawn from cognitive behavioral therapy, or CBT, for concerns like anxiety and low mood. Why does this matter so much? Because often the hardest part of getting help for anxiety is simply getting started. The referral, the diagnosis, the cost. Each one is a hurdle. A no cost, no referral front door lowers those hurdles a great deal. Low-intensity support will not be enough for everyone, and more complex or severe panic usually needs structured therapy. But as a first step, or a stepping stone, it is a very welcome addition. The third development zooms right out to our genes. A landmark genome-wide study of anxiety, published earlier this year, analyzed more than 122,000 people. Its message is worth repeating. There is no single anxiety gene. The study pointed to 58 separate genetic regions linked to anxiety, each adding just a small amount of risk. In other words, anxiety is polygenic. It is shaped by many tiny genetic influences, all interacting with life experience, stress, and environment. I take 2 things from that. First, it is destigmatizing. If you live with anxiety, it is not a weakness, and it is not something you simply chose. Second, and just as important, genes are not destiny. A genetic leaning can raise the odds, but it does not lock in the outcome. The brain stays remarkably responsive to learning and to therapy, which is exactly why psychological treatment can help. So what do these 3 stories add up to? Pull them together, and a hopeful, accurate picture emerges. Anxiety and panic have real biological roots, both in the brain and in the genome. But those roots are not a life sentence. Effective, Evidence-based help exists, and right now in Australia, that help is more within reach than it has ever been. From free low-intensity programs through to structured CBT with a registered practitioner. If panic attacks, or a constant hum of anxiety, are quietly shrinking your world, I would gently say this: that is a reason to reach out, not a reason to wait. At our Bella Vista practice, Potentialz Unlimited, our team offers CBT and other evidence-based therapies for panic disorder, generalized anxiety, social anxiety, and related concerns. With Medicare rebates available through a GP mental health care plan, you can read the full weekly roundup, or get in touch with our practice, using the links in the description below. And if things ever feel unsafe, please reach out to a crisis line straight away. Support is available around the clock, and you do not have to carry this on your own. Before you go, here's a quick recap of what we covered. How we read the week's research. The largest brain study of panic disorder. Medicare's new mental health check-in. Why anxiety is polygenic. What this all means if you live with anxiety.